Let's talk about staging med kits. We got asked the question a lot, how should I stage my trauma gear? Can you take a look at this kit to make sure it's staged correctly? And the short answer is, well, we've got an algorithm that explains this whole thing in layman's terms, which is March, right? We want the massive bleeding control tools the most accessible and easily accessible, and then followed by airway and respiration related interventions, and then circulatory and hypothermic shock, right? So the algorithm's there, just stage your kits based off that. So let's take a look at an example. As soon as I open up this IFAC, the first two things that are free floating are a CAT tourniquet and full-size trauma shears, right? Now I can stop massive hemorrhaging on an extremity relatively quickly, and I may need to expose the wound to wound pack or to remove heavy garments in order to not compress the garment, but really compress the tissue if I'm applying a tourniquet to an extremity. Right behind that, got a wound packing kit of hemostatic gauze, roll gauze, and 2 pressure bandages, right? So again, more bleeding control tools, very easily accessible. Next, we've got our airway problems. So a good halo chest seal, some PPE, some tape to secure everything, and an emergency blanket to start to manage some symptoms of hypothermic shock. Right, so if you're building out, whether it's a small on-the-body kit to a massive professional med bag, you should be staging it in accordance with the precedence of what is going to kill your patient the fastest.